Hello everyone, welcome back to another episode of Coffee and Chiropractic, 40 Weeks of Kadi edition. I have Katie Englehart here with us. I'm Dr. Nicole Heatherly. Thank you guys for joining us. This is the first week Katie and I are going to talk to you guys about birth plans, and she's getting down to the wire. She doesn't have that much longer to go, so it's really important to have your birth plan squared away, so you're just going to make the process easier. One thing I wanted to mention before we dive into the birth plans is that you really want to be aware that not everything is always perfect. It may or may not work out exactly how you planned it. And that's why it's always good to have a plan B, a plan C. If this doesn't happen, what's next? So that's really the point of the birth plan, to make it less stress on the mom and dad when you're going through that process, so you can enjoy it as much as possible. So this week, Katie is 27 weeks pregnant. It's crazy. It's flying by.
Yeah.
It's gone so fast. Maybe a little more quick for me versus her, since she's the one growing the baby. So at 27 weeks, the baby is the size of a head of cauliflower, which seems huge. It seems, we'll say an organic cauliflower, so it's a little smaller than those huge ones you see in the store nowadays. So guys, the first thing you want to kind of sort through with a birthing plan is just to decide where you're giving birth. So, pretty much you have three options. You can give birth at home, you can give birth at a hospital, or now it's becoming more common to deliver your baby at a birth center, which is kind of this in-between zone between a hospital and a home birth. So what did you choose, Katie?
I chose a birth center. I'm going here locally to the Frederick Birth Center. It's a beautiful facility and I feel super comfortable there, so I'm really happy.
Yeah, and what are some of the deciding factors of why you chose, and you don't have to dive too far into it right now, but in general, why did you choose a birthing center?
I wanted a more natural option. I wanted to be able to kind of move around a little bit more while laboring. I wanted something that matched my personal beliefs, and it seemed like the birthing center kind of lined up with all of that.
Yeah, and she's absolutely right. There are two ends of the spectrum. If you have a home birth, it's very natural. There's absolutely no medical intervention, no machines, nothing. A hospital is equipped for all of that. Anything that goes wrong, they're equipped with. And then the birthing center is this in-between zone, more oriented towards a natural home birth than a hospital birth. And we'll dive into a little bit of the differences here in just a few minutes. But Katie's absolutely right. It's just more of a natural alternative. And actually the birthing centers are becoming more popular. The one that Katie's going to just opened this past year.
I think so.
Yeah, so they're fairly new. So the trend is shifting towards that. And we know why. It's because as women, we're built to give birth. We're built to deliver a baby. Way back in the day, there weren't these medical interventions. People have home births all the time with absolutely no doctors or nurses or midwives, anyone there, and I'm not recommending that per se, but my point is we've become more medically oriented. We have fear in us that something's going to go wrong, that I want to be at a hospital because what if XYZ happens, and the reality is we really need to work on taking that fear out of our minds, because we were built to do this and it happens all the time. And the other thing to note is there's always a backup. So if you choose a home birth or you choose a hospital, there are other plans where you're going to be transported to a hospital anyway. So actually, I wanted to give you guys a statistic so you can see how large the number is where people are giving birth in a hospital. It's 98%. Wow. 98%. And the biggest thing with a hospital birth, so I'm so glad you're choosing a birthing center, is we're on this time constraint. Everything needs to be done right away. So with a hospital, more C-sections are happening. Of course, if it's a weekend, why wouldn't the doctor want something planned? I can go to the hospital at 8 a.m. versus I'm going to get this call whenever the mom's going into labor in the middle of the night. So it's very unfortunate. It's an unfortunate trend. So that's why I personally always recommend, if you can, if it's feasible for you, home birth or natural birth or a birthing center birth are definitely the way to go.
Yeah, and that's not to say, hospitals do save lives. There are situations that come up that the medical intervention that are there are what keeps the baby and the mama alive, and that's important. We're talking more about, in an ideal situation when mom is healthy and baby's healthy and there's not concern there.
Yeah, so. Katie has no pre-existing conditions. She's perfectly healthy. She eats a good diet. She exercises. She gets her chiropractic adjustments to make sure her nervous system is functioning properly. So she's doing all the right things to be able to have a birthing center birth. I always recommend, when you are deciding where to deliver a baby, think about your own health. So women who are diabetic, women who the baby is in a breech position, if you're expecting twins, because it's just a different game, if you have preeclampsia. So those are some of the things you want to consider, weigh the pros and cons of hospital birth versus home or birthing center. So now I just want to dive into some of the main things about the birthing center, and as we go through that, we'll kind of talk to Katie about what they do.
Sure.
So let's talk about induction and augmentation of labor. What is the birthing center typical protocol?
So for the birthing center, they don't do any augmentation of labor. Nothing that's like they don't administer Pitocin or any other sort of like medical interventions to get labor started, or to make it go faster. There's some natural things that they can recommend, different things that you can try at home and things like that. But for the most part, their belief is more that it's gonna happen when it's gonna happen, and baby's gonna come when she's ready, and that's the way it's gonna be. So.
Yeah, and that's actually really awesome, because one thing that happens oftentimes at a hospital is that there's this failure to progress, which means the labor just isn't progressing. And a lot of times what happens in a hospital setting is when there's failure to progress, they deliver a drug to augment the labor. They deliver Pitocin to make it happen more quickly. Well, what happens with Pitocin is that it actually, you actually have more cramping, and it's a more painful labor, and it can actually make for a longer pushing time. So you really want to think about those things. And then it's also important to note that at a birthing center, they still have backup plans. So what happens if you you're like, oh, I do want one of these drugs, or I'm pushing for 12 hours, what would happen at that point?
Yeah, there are instances where the mama would be transported to a hospital. So if we decide that we want that things aren't going the way that is expected, or if there starts to be some sort of concern for safety for mom or baby, or if mom needs pain medication, then at that point, that's when the hospital transfer would occur.
Yeah, and that's why, on the front end of stuff, before you get in that situation, you have your plan A, plan B, plan C, and Katie's got all that lined up. So next, one other thing that's different between a hospital and birthing center is they don't do any electronic fetal monitoring at a birthing center. They do sometimes use Doppler ultrasound, which is a lot healthier for the baby than electronic fetal monitoring. Any electronic waves. So when we talk about ultrasounds, really you want to just limit anything. Certainly there is a time and a place for those things. That's not me saying never get that, but if you can limit it or eliminate it, why wouldn't you? Less is more. The biggest thing when people decide to have a baby at a birthing center or a hospital, and this is, I think, the main thing moms think about when they're delivering a baby. They're like, how bad is it going to hurt? So you're thinking about pain relief options. Right. So what's the main difference between a birthing center and a hospital?
So one of the main differences that I've found in my experience so far, and I can't speak to all birthing centers or even to Frederick Birth Center being like this for everybody, but one of the main differences that I've found is they don't, at the birth center where I'm going, they don't offer medication for pain relief. That would require the hospital transfer, and that's right up front. So that's not something that I wanted in my birth anyway. There are a lot of studies that are out there that talk about those medications and how they affect the baby. and how they affect my perception of the experience that I'm going to be going through. And that's something that I would like to avoid. Now, I've never given birth, so I don't know what it's going to feel like, but I do know that there's a difference between pain and suffering. And if we're in pain or we're feeling these strong waves of contractions, it's for a purpose, and it's an experience that not everybody gets to have in this world. So it's almost an honor to be able to have that experience. And keeping that mindset, I think, is, from what I've read, really going to help. So,
yeah. You touched on a few really good points. You know, with anything the mom puts in her body, so food, medication, anything, it's going to the baby also. So the mom is being induced, being delivered a drug, it's going to get in the baby's system. And not only could it have detrimental effects on this little baby whose immune system it has not developed yet, those effects could be detrimental. But also, you know, we're full believers in the power that made the body heals the body. And, you know, medical intervention should be kind of deemed as like an emergency intervention. We believe in emergency medicine. There is a time and a place where you need those things. But if you can do it without, why not? You know, again, back in the day, we didn't have these drugs. Right. You know, a mom delivered a baby. You know, animals that have babies in the wild, do you think they have medical intervention or are given pain relief? No. So that's one important thing to note. And then the other thing Katie talked about was truly feeling the experience. And this is something that I don't think most people think about until after they deliver the baby. So the moms that I hear from who actually had that experience and did not have pain medication, they wouldn't change it for the world. They're like, I am so glad I got to push. I am so glad I got to feel those contractions and feel the baby coming out and feel the process. I mean, you'll never get to feel that again. And Katie's right. It's a privilege. You know, you're blessed to be able to do so. I have so many patients who can't do this, who can't have, you know, who have fertility issues for whatever reason. So it's truly an honor to be able to do that. And one thing else I wanted to mention was that we talk about hospital transport. So I think it's important to note that you want to be aware of the hospital closest to the birthing center or the hospital that they would transport you in that scenario. Because let's say you love the birthing center, but there's this really horrible hospital. Well, you want to consider maybe choosing a different birthing center or changing the transport, because it could happen that you have to be transported there. So you just want to be aware of it. Another big thing, so with pain relief, we talked about no pain medications for labor. However, some birthing centers do have local analgesics, and that's for if the perineum tears when the baby is being delivered. Mm-hmm. There are some things you can do ahead of time to reduce that, and birthing centers are really awesome at educating women on doing that. You can put oil down there. You can do a perineum massage, but you want to be doing that a couple months up until you deliver. That way you're preparing that area. You know, you're increasing the elasticity of the tissue so it can expand and stretch as the baby's coming out of the canal. You know, with a birthing center, we talked about being transported. So, you know, with that, there's no operative delivery. So if it comes down to a point where you would need a C-section, of course, you'd be transported towards the hospital. And then the last thing I wanted to note with birthing centers is that, you know, and keep in mind, guys, all the things I'm telling you are not across the board. You know, sure. It's a generalized answer. And also with a birthing center, some are associated with a hospital. So some of these things, some birthing centers are more like a hospital with this medical equipment. But most do not have any medical equipment or major medical equipment, especially for the baby, other than oxygen and catheters to clear the airway after the baby comes out of the womb. So these are just some of the things, you guys, that we wanted to give you. Obviously, there's so much more, as Katie knows, and it's why we're going to do this each week, so we can kind of talk through some things. And it's not necessarily to give you all the information. What we want to do is bring up these things, make you guys aware so you can go do your own research, because, you know, if you're educated, you can make an informed decision, and that's what we're huge proponents of. You know, just educate yourselves. That way you can make the best decision for you and your baby. Yeah. So anything you want to add for everyone?
I think just what you said. I mean, it's your body, it's your life, it's your experience. So go with what makes you comfortable. And the biggest thing that I can say is just anything that somebody tells you, do your own research on it. Don't just assume that if somebody says this is what you should do, that's what you should do. Check it out for yourself and make sure you're making that decision. So if it comes down to it and something goes wrong and that is a decision that somebody else made for you, you don't want to have that experience. You want to make sure that what you decide is entirely your decision based on your research and the input of people that you love and care about. So I think that's just the most important thing is, make this your own. You only get to do this pregnancy and this birth once.
Yeah.
So make it what is best for you.
Yeah, and enjoy it as much as you can, because it can be an enjoyable process.
Yeah.
So, all right, guys, thanks again for joining us for another week of Coffee and Chiropractic, 40 Weeks of Kadi. We will see you next week. Have a
Have
good
a great
one.
day.